How's your study prep going on?
Just trying.
Just right. Okay, no. Try harder and harder and harder. There's no margin to not to capture this exam, inshallah. All right.
Inshallah.
And how are you
Whenever
finding
I'm
the
getting time,
Yes,
whenever
yes.
even a single minute getting time, trying to practice all the questions behind.
Excellent. Well done. That's the
Just
spirit. That's what we
always
want to
keeping mobile with me all the time.
Excellent. Excellent. That's what we want to hear. Yes, yeah.
Thank you.
There are 10 minutes remaining to the live webinar, and we just wanted to sort of break ice, and we'll see, who else is online, and how are your preparation going on before we talk about the clinical examination after the written one then. So that's going to be something exciting today. I'll take about an hour or a little bit more, just over an hour, to talk about how to crack the OSCE exams or how to crack the clinical exam. So where are you online from? Nazia, I know you are from UAE. What about you, Anila?
Currently, I'm in Riyadh.
All right, okay, great. So you're on the same time zone as myself. Yes, yeah.
Yes.
So this is weekend for you, huh?
Yes, I'm not here doing any job in Riyadh. Actually, I'm living in
All right.
Pakistan.
Okay,
Yes,
so this
I
is
met you in the on-site mock as well in the April.
excellent, excellent, fantastic. And hopefully, inshallah, you pass your exams and then we see you in the conferring ceremony in Dublin as well. Yeah.
Inshallah.
Excellent, excellent. All right. We're just waiting for people to join in, and we
Yes,
are
no problem.
live as well. And then we are going to talk about the pathway to success for the OSCE as well. It's coming to close to 6 p.m. our time in Riyadh, and then it's 8 p.m. in Pakistan, I believe. And this will be recorded and this will be shared online on all our social media platforms for MedExam Expert as well. So so you can just spread the word, and you can talk to your colleagues about, just have a look at the video if they weren't able to join in, because there's a lot of us who are working, who are on duty, who are on mute. So it's very important that everybody gets the hang of how to crack the clinical exam, the OSCE and the long case. I remember when we did the OSCE and the long case, when I did the OSCE and the long case for the membership, that was a long time ago. This is what, 2024. I passed my MRCPI exam in 2002. So at that point in time, there were no simulated patients, there were real patients. So the long case would be on a real patient, and then the short case or OSCE would be on, with the examiner. And then the long case would be, there would be two long cases, one gynae and one obstetrics. So that was like a very, very like a robust sort of an exam in a hospital, and where you could get anything from a laboring patient to somebody who is an oncology patient receiving chemotherapy, and it used to be very overwhelming at the same time. So life has come a long way, and things have been more sort of an interactive and artificial intelligence oriented. So now we have all the simulation and all the online exams and everything. So it's become a bit more approachable, I would say, use the word approachable, and a bit more easier as well, in terms of logistics of the exam. So today we are going to talk about all about MRCPI OSCE and how we feel is the pathway to success. So my name is Dr. Shazia Maqsood, and I'm one of the MRCPI examiners convener for the college as well. And so whatever we talk about for part 2 written as well as part 2 clinical, there's a lot of feedback that's coming from the examiner side, how the candidates are expected to present themselves will be included in this 1 hour session. And we really want all of you to pay attention and to be able to crack the exam in the first go, because believe you me, once you have the knack of the curriculum of the exam, it's not a difficult exam at all. It's all about how you manage your time, in terms of 10 minutes for the OSCE and 25 minutes for the long case, and also how you decipher your OSCE, how you present your OSCE, how well you are prepared, how articulate you are, how empathetic you are, how safe you are, how communicative you are, and what overall expression are you creating in front of the examiner as well as the role player. So these are the keys to your success then. MRCPI, or the Membership of Royal College of Physicians in Ireland, is an internationally recognized qualification in OB/GYN now. And it's not only accredited by the MRC Ireland, but it's also recognized by the GMC now. And if you are having the membership of the Royal College of Physicians in Ireland, and you want to go to the UK, it means that this medical graduate can apply for full registration with the license to practice in the UK. So that's also an added advantage, because somebody was asking me, some of you were asking me, what in your opinion would you think that why, this exam is equally as important, because people prefer to do MRCOG sometime. But I really encourage you that, if you are going on the track of the MRCOG, take the track of MRCPI hand in hand. There's no harm in getting 2 degrees at the same time. And believe you me, including myself, I have a lot of my students, a lot of my colleagues whom I have sort of convinced, to take both the exams together. And now most of them are working in consultant post in all over the world. So basically, the candidates sitting for the MRCPI OB/GYN, you'll be for a clinical, there are maximum number of 6 attempts within 3 years. So somebody was asking me how many attempts do we have. So that's why I always include this kind of a slide in the portfolio of how to run the exams. So total 6 attempts are allowed, and in a period of 3 years time. I have a small video while we are all gathering. This video was taken at the time of my fellowship back in 2019, because it takes more than 10 years for us to be working in OB/GYN after doing the membership to be able to be eligible to apply for the fellowship. So this is a little video from the Royal College.
Royal College of Physicians of Ireland. It's an immense privilege. It means I've earned the to go through the process in order to actually become a fellow. That involves getting people to nominate you. And that also means that there's a period of reflection as well, and thinking where you've come from. Going from a member to a fellow, I didn't realize how symbolic it is to actually take that step forward and to really realize you are a member of a very august organization. It's wonderful to be here and to be part of all of that.
To become a fellow of the Royal College of Physicians of Ireland, I think, is a crucial component of the training of any physician in Ireland. I think increasingly so, we're being asked to become ambassadors for our patients and to become more vocal in broad clinical issues that extend outside of the hospital systems where we see patients.
Becoming a fellow of the Royal College of Physicians is a tremendous honour. So it's a tremendous sense of achievement and acceptance in the medical community, especially by the key opinion leaders, the people who are making the decisions about the future training and direction of doctor education in Ireland in the future, and indeed internationally.
Become a Royal College Fellow means the world to me. The most important thing is that my life has come a full circle. I have been in Ireland for more than 15 years before I moved out to Saudi. And coming back, I can tell you very confidently that the Royal College has been the centre of excellence and centre of standard and care and safety.
I'm delighted to be offered the opportunity of becoming a fellow of the College of Physicians. Medicine as a career has been good to me, and it's great to have the opportunity to give back. I think it's about becoming part of something that's bigger than yourself and being part of a community that cares about the future of medicine in Ireland.
Okay, great. So that was a video that the first lady that you see in the video is Dr. Mary Higgins. And Dr. Mary is the chief examiner for your RCPI exam in OB/GYN. And also, I'm the convener for the exam in Saudi Arabia, in Riyadh. And the center is Dr. Suleiman Al Habib Hospital, Al Rayyan branch in Riyadh. We are not only running the MRCPI and OB/GYN, but we are also running the exam for MRCPI clinical for medicine as well as pediatrics. So again, you're going to join a global community of doctors learning together to improve people's health. You'll be recognized by the GMC in the UK. More importantly, you will advance your career quickly in terms of your promotions at work. And there are more spaces available now in these exams, so it's easier to get a slot for your exam. For the written exam, as you know, that there's remote invigilation. Also for the OSCE exam, there are now examination centers, so many examination centers near you. So there is Riyadh, there is Dubai, Al Ain, there is Muscat. So all these places, are having, new examination centers, which basically means that you do not have to worry about your Irish visa, Irish travel, hotel, etc. So wherever you are in the Gulf area or in the Southeast Asian region, you can easily travel to these centers now. All right, so we'll talk about the OSCE and clinical exam structure and rule, and more importantly, what needs to be successful. So the first thing first, your next exam is in November 2024. I'm being told that it's going to be around 10th and 11th of November, the OSCEs. So for that, your opening date will be the 7th of August, which is next month, and the closing date will be 25th of September, and your the results will be announced 4 weeks after your November exam, which is going to be in December. Now, if you have your mobile phones, you can take a photo of this. These are the examination rules and regulation. I just made it in a barcode just to make it simplify for you, how to apply, what to apply, when to go online, etc. So all the details for you are over there. And this will be shared, as a live video on our social media platform as well. So don't worry if you cannot capture an image now. You can always capture it later. Now, we'll also talk about the basic specialist training curriculum. We keep on updating this curriculum. So there was a different curriculum back in 2022, then 2023, and then now more recently 2024. So again, I'm simplified for you, and I made a barcode for you guys. You can take a snapshot of this and open the latest curriculum to see what exactly is it. And the next few slides, we are also going to discuss these curriculums briefly. And then when we are going to open our long course online, we are going to discuss all these topics in the curriculum as PDFs. They will be distributed to you also. And we will be summarizing them so that, it's easier for you to remember. And also when we are going to do the mock circuits, we're going to briefly touch all these curriculums and all these topics in the circuits that we are going to run for you. So all in all, it's going to give you a good idea of how to go about with the exam. So our exam of part 2, OSCE and clinical, it contains these kind of OSCE that are problem-solving OSCE. They are talking about investigation, treatment, clinical and communication skills, safety, and more importantly, differential diagnosis, okay? So this exam is held twice a year in Ireland and 3 times a year in Gulf region. So you've got a lot of opportunities during the year to sit for these exams. So one exam center is in Ireland, which is in Dublin, and there are 4 examination centers between UAE, Oman, and Saudi Arabia. Now, the OSCE, it has 7 10-minute stations, including a communication station. And we'll tell you exactly what each station comprises of, but there are 7 stations, and overall what the way we lay the circuit is that you will be having 2 rest stations in between. So usually station number 4 and station number 8 is your rest station. So altogether we lay down 9 stations, out of them 2 are resting stations. They're all 10 minutes each. Unlike the MRCOG, where you are reading the OSCE 2 minutes outside and then going inside and performing in 10 minutes, it's not like that over here. It's slightly different. You have 10 minutes to perform when you go in, when the bell rings. So when the bell rings, you go inside. When the bell rings, you come outside. What about the clinical examination? The clinical examination has 1 simulated clinical case, okay? So either you're going to be given an obstetric case or a gynecological case. There is going to be a role player, a simulated player, and there's going to be 25 minutes. So again, you're not standing out and reading anything. When the bell rings, you go inside and your 25 minutes starts when you are inside. And then when there is 15 minutes remaining in your long case, then a bell rings and somebody will remind you that there are 15 minutes remaining, which basically means that you have to wind up your examination. So in the clinical examination, there will be mannequins, models, there will be a role player, you will be required to take a history, you'll be required to examine the equipment and the role player before discussing the case with the examiner, and there will be 2 examiners in the long case, and there will be 1 examiner in the OSCE in the afternoon. So long cases are usually in the morning, and OSCEs are usually in the afternoon after lunch. Now, one more important thing is that when we run the course online for you, we are going to make sure that we are going to make you experts in history taking, timely history taking for the 10-minute OSCE as well as for the 25 minutes long clinical. It is very important. It's very, very important that you manage your time. Without time management, you're going to lose the plot. So let's talk about the OSCE then. What about the structure of the OSCE? Do we have any questions in the meanwhile? Let me see who are there in the chat and who are there in the participant. Let's see. Dr. Eustace, hello. Where are you login from? Very, very welcome. Dr. Nazia, Dr. Olisa, Dr. Hanif, Rabia Hanif, Dr. Sadaf, very welcome all of you. I'm sure you're from different parts of the world, and I'm sure you have a lot of questions for us, as to how to crack this exam. So I'm going to stop right here. Come in the chat box or open your microphone and let yourself known to us. Tell us what exactly are your expectations, what exactly are your fears. Let's discuss the fears also, and let's see how we can together crack this exam. So anybody come in the chat? All right. Hi, Dr. Nazia. How are you? Great. Great. So I'm getting one question in private that, we are very afraid of how to do a time management. That's exactly what I'm talking about, Anonymous. That time management is very important. So when you are practicing the exam at home, always keep a timer with you. So it should ring within 10 minutes if you're performing the OSCE, and it should ring within 25 minutes when you're performing the long case. So this is the structure of OSCE, 9 stations, as I said, and out of those 9 stations, then 2 are the rest station, which is station number 4 and station number 8. And then the station number 1 and 6 will be obstetrics. This is how the layout is. So if you're going into station number 1, expect it to be the obstetrics. If you're going into number 6, expect it to be obstetrics. And then we have station number 2 and station number 9, which are gynecology. And then we have station number 3, which is a must, which is the labor ward management. And then we have station number 5, which is communication, and station number 7, which is simulation. So this is by and large the layout of your OSCE, that each component will be discussed and described in different stations, and you'll be expected to know everything about these managements. The labor ward management is usually what we keep is a labor ward board scenario, where you'll be given 6 or 7 cases, and you have to discuss those cases with the examiner and tell them what is your priority, what is your safety points, what is your risk management point, what is your team management and communication, what are the differential diagnoses, if any, in that case, etc. I think most of you are always afraid of time management for the labor ward management, and that is why it is very important that when we are performing these OSCEs as a mock online as well as on site, we will make sure that we focus on time management as well. All righty, so enough about the structure of OSCE there. Now let's come to the clinical examination. Now, in terms of clinical examination, as we said before, it is a single simulated case, either obstetrics or gynecology. So, I do not know, like today I'm going for my exam. I don't know whether I'm going to get gynae or whether I'm going to get OB. And it really depends on my luck on that day. Okay. So the duration is 25 minutes, and simulated means that there will be a role player or there will be an actor, and you definitely have to take a history. And then you have to examine the model in front, and then you will examine the model and keep talking while you're examining to the role player as well as to the examiner if you have to explain anything. Say, for instance, now if you would allow me to examine you, please kindly come up on the couch, and then you will get up and you will start examining the model. You say, I'm going to clean my hands first, I'm going to wear a pair of gloves, I'm going to be gentle, I'm going to respect your privacy. This is the speculum that I'm going to use to be able to have a look inside your vagina to make sure that the cervix is normal, that the vaginal cavity is normal, to make sure you're not bleeding or etc. Or if it's an obstetrics OSCE, you can say that I'm going to examine you. I'm going to put a hand on your tummy first, and then if you're in labor, then I may need to examine you from down below as well. And the pet question of the examiners when it's an obstetric OSCE is always remember that, it's very important that you know how to do an abdominal examination for an obstetric mannequin, vis-a-vis how to do the Pollux maneuver, how to do the symphysiofundal height, how to examine the patient, and at the same time, how to observe for any sign of pain or flinching in case if the role player is telling you that she's in pain, how to control that kind of situation. So it's like a very interactive 25 minutes that you're going to spend inside, and that 25 minutes, believe you me, is your 25 minutes. Do not get distracted. Do not get nervous, and keep your nerves calm. And we will also teach you during these courses how to keep your nerves calm, how to present yourself during the examination to be able to have a win-win situation. And the discussion will be of the management between the two examiners. Usually one of the examiner may take the lead and the other examiner may be busy marking you, or the examiners may divide their questions and it be asking you half and half. It really depends. When you're doing the examination, one of the examiners will be standing with you and asking you questions about the examination. So another tip is that whatever props are available on the table, don't get blindsided because of the exam nerves. Always, I would say, check what props are available. If there are gloves, use them. If there is jelly, use them. If there's a speculum, use them. If there is symphysiofundal height measuring tape, use it. If there are any other props, at least take them in hand and use them so that the examiner knows that you're familiar with using these props. All right, and then there will be a general discussion while you're winding up. When the bell rings that there is 15 minutes remaining, at that point in time, you must have finished your history and your examination, and you must be ready for discussion actually. Okay, so one important thing is not be late for your examination. So there's a good idea that, if you're not familiar with the exam center, so have a look at the placement of the exam center a day ahead of time so that you know exactly on the morning of the exam when and where you have to come, number one. Number two, do not be late for the examination and always carry whatever the RCPI has emailed you. If they're telling you to bring in a photographic identity or the letter from the RCPI, please bring them with you because that will be used for registering you the first thing in the morning when you arrive. All right, so you may ask, what is there required to pass? How do I pass this exam? So, when we are doing assessment as an examiner with our marking sheet, we have 4 things to mark you. Either you are an excellent candidate, or you're a clear pass candidate, or you're a borderline candidate, or you're a fail candidate, okay? So that's very important that you understand. So for the OSCE circuits, remember you have 7 OSCEs and 2 rest stations. For the OSCE, you may fail a maximum of 1 station. So out of the 7, if you have passed 6, you will still pass the OSCEs, okay? You will pass the exam overall. However, having said that, you must pass the long case, the obstetrics or gynecology, the clinical case. Otherwise, so it's like, say, for instance, if you do not pass the long case and you pass all the OSCEs, you will not be able to pass the exam. So the long case passing is a must. And then amongst the OSCEs, out of 7 OSCEs, if you pass 6, then you're overall pass. Okay. Now, what are the key knowledge areas for the OSCE and clinical? You may ask. Of course, the Institute of Obstetrician and Gynecologists have the National Clinical Guidelines. These guidelines are easily available for those who access our courses online for the med exam expert. And this is again a barcode for the National Clinical Guidelines that you can utilize later onwards after we finish this webinar tonight. All right, so this is just like, just to give you an outlook. And of course, this keeps on changing. We talk about stress incontinence. We talk about, like, say, for instance, we talk about urogynecology. So there were new guidelines about stress incontinence, mesh complication, POP or pelvic organ prolapse. We also talked about placenta accreta spectrum or PPH, postmenopausal bleeding, early termination of pregnancy. This is a very important guideline. Recurrent miscarriages, fetal anomaly scan, stillbirth prevention, VBAC, prevention of GBS. So all these guidelines are important for you to read. And we have summaries of these guidelines available to share with you when you join our course. So in the OSCE, an ideal candidate, ideally you should be, as I said before, confident. Confidence is the key. You come in, you give a small, subtle smile, you say hello, and you sit down, and then you give your, so basically in the exam, you're given a sheet of your name stickers. It has your candidate number on it and your name on it. So you will carry that sheet throughout the day for your clinical as well as for your OSCEs as well. So when you go inside, you give that sticker to the examiner so that examiner can put it on your marking sheet. So when you're going, so again, that's the best way. You go inside and you say hello, whichever part of the day it is, good morning or a good afternoon, you greet, and then you sit down and you give the sticker. And then you start reading, or the examiner will guide you that, okay, the scenarios in front of you, you can read and start. So you can start, and then when you're ready, you can say, I'm ready, and you can start then. So you have to be confident. Unless and until you do not practice this in front of the mirror, with yourself, in exam courses like these, what MedExam Expert is offering, or with your friends in front of the mirror again and again, you might not be able to crack it confidently. And you should be well presented. So like you should know what is the structure of my answer. I have to start with a history. I have to wind up the history. I have to come up with investigations, and I have to come up with justification of investigation. I have to come up with a management plan, and I have to wind up my OSCE before I move on. And same goes for the clinical. Plus in the clinical, you have to examine the patient as well. So you have to describe the examination findings and the differential diagnosis as well. So you should be well presented and well-rounded. There will be, an A4 paper and a pencil provided inside the stations. So if you want to jot down some notes, jot down a template so that you can speak clearly, please use that. This is for your own benefit. And speak clearly. So sometimes, we may need to ask the candidate, can you please speak a bit louder? Because they are very mumbling, or they are a bit nervous, and they are not able to interact with the role player very clearly. So the examiner will prompt you to speak clearly then. And then present the best version of yourself. The most important thing is that, what I notice in the exam is that on that day, you should be well dressed, comfortable dress, comfortable shoes, because there's a lot of walking, there's a lot of standing. So you should be feeling comfortable, but do not wear I will give you an example that there was one candidate, where in one of our mock exams, there was one candidate who came and who was wearing a very large necklace. So we had to tell her that she has to undertone her dress, okay? So again, in another one of our mock exams, there was one candidate who had her goggles on top of her head. So we had to tell her that it's not a good idea to carry goggles on top of your head in an exam scenario. So make these mistakes in the mock exams, it's absolutely fine, but don't make these kind of mistakes, or don't dress, unevenly or untidily for the exam. That's very, very important. All right, so now we'll talk about some example of the OSCEs. I see there are a lot of people joining us now. Hi, Dr. Khadija. Hi, Dr. Gulshan. How are you? Hi, Dr. Sidra. How are you? And okay, there are a lot of you. Okay, Dr. Shazia, Mr. Zishan. Everybody, very welcome. And we are going to talk about OSCE example, and then we are going to talk about clinical practice. I'm fine, Gulshan. Thank you very much. Okay, so without much further ado, let's see what we can do in an OSCE. So this is like a typical example of an OSCE. This is the 10 minutes one, all right? So your candidate, and so the bell will ring, and you will be asked to go inside. Somebody will say, go inside, and you will go inside. Okay, and then there will be this candidate information there. So you say hello to everybody, you pass on your sticker to the examiner, you sit down, and you start reading. So your information is that there is a 34-year-old woman presenting for antenatal care, having previously been diagnosed with SLE. So your OSCE task is to discuss the effect of this on her pregnancy and how it is going to influence her care. So Now, having said that, now that we are sitting in a webinar and it's not an exam, when we say a medical complication in pregnancy, you say, my, oh my, this is not going to finish in 10 minutes, is it? And that's where, you know, your nerves start settling in that I may not be able to finish it in 10 minutes. But if you have prepared wisely, if you have a template to answer for medical management, medical complications in pregnancy, then believe you me, this is one of the most easiest OSCE because there's a lot of theory involved in there. And when you answer in a format form and in template form, then it helps you in answering. So the next few slides, I will show you what a typical role player or a simulated patient instructions are, and exactly what exactly is involved in an examiner key as well, to be able to see how you are going to answer these kind of sort of long topics in a 10-minute OSCE, okay? So again, let's read it again. A 34-year-old woman, antenatal care, having previously been diagnosed with SLE, discuss this effect on her pregnancy and how will it influence her care. So I would like to ask the audience over here, what are the thoughts in your mind before we see the next few slides? What are you going to ask her? Let's come in the chat. I was thinking I will ask her, because she's SLE and it's related to miscarriages, perhaps I'm going to ask her about her parity. What are you going to ask her about? Come on, everybody, wake up, wake up. All right, okay. Answers are starting to come in now. All right, Rabia, what do you think? Sadaf, what do you think? Shazia, what do you think? Dr. Nikoyinam, Olisa, what do you think? Dr. Khadija, Dr. Sidra, Dr. Gulshan. Everybody, come in the chat. All right. And miscarriage. Yes, yeah. Plan for fertility. Great. Excellent. If she has any children, parity. Absolutely. What treatment was she taking before and during pregnancy? Excellent. Excellent, Dr. Okay. And so on and so forth. Isn't that right? So even before we start this, even before the bell rings for 10 minutes, we have sort of a plan in our head, what we have to start, how the disease control, any flare-ups. Very good, Dr. Anila. Excellent. All righty. Okay. So now let's go to the next slides and see how we are going to, you know, sort of aggregate our thoughts into answering the question. So first of all, it's a good idea to see. Just bear with me for 1 second. So this was the candidate information. Now this is the examiner information. Okay. So this is the examiner information that the examiner would like to know. What clinical information will you tell the examiner? Do you have any differential diagnosis for this? Do you have any clinical judgment already? How will you do risk management for these cases? And what will be your communication skills for this sort of a case? Okay. So remember, this is an OSCE. So there is no role player over here. So this is between the examiner and you. Now, so this is the information that the examiner has in front of them. So the candidate should take a detailed history. How was the diagnosis made? When was the diagnosis made? Okay. Was there a blood test done? Full blood count, ESR, anti-nuclear antibodies, anti-DNA antibodies, anti-Rho, anti-La, anti-phospholipid. Because we know that 30 to 40% of women with SLE have antiphospholipid syndrome. So the most important thing was, as one of you, I think Dr. Anila was saying correctly, when was the last flare? And she should be aware that the pregnancy may increase the possibility of a flare, more commonly involving the joints and the skin, occurring at any stage of pregnancy, and more likely that the disease is active within 6 months of pregnancy if there was a recent flare, right? And then to ask, has there been any preconceptual folic acid given? Has she been taking any aspirin? What medications are they and their safety for the patient? And the candidate must be able to tell the examiner that the outcome would be better if she conceived during the period of disease remission. And the candidate should also ask, were there any obstetric issues in the past, like hypertension, thrombosis, preeclampsia, miscarriages, IUGR, stillbirth, because all these things are relevant with the history, medical history. So again, the candidate should be able to talk about if there is any role for aspirin, if she has antiphospholipid antibodies or chronic hypertension. And what about her obstetric needs, and what about her antenatal care? The candidate should be able to clearly explain that. So this is the sort of clinical explanation that the examiner will be expecting from a good candidate. And what about the differential diagnosis? Now, remember, the one big difference between our MRCOG exam and the MRCPI exam is a differential diagnosis. So in your OSCEs, you have to talk about differential diagnosis, please. Okay. So depending on the specific of the case, you can talk about that there could be other differential diagnoses like skin disorder, like arthritis, kidney disease, or any blood-related disease. And you will also talk about multidiscipline involvement according to her history, either the hematologist, fetal medicine, anesthesia, rheumatology, dermatology, and renal. Okay, so this is very important in terms of safety, that you talk about multidiscipline approach, risk management approach. And what about the antenatal care? Now, this is true for all medical, complications in pregnancy, but this one is specific to SLE. So you have to ensure that the pregnancy is ongoing. You need to do the baseline test. You need to do a 24-hour urine collection if she was proteinuric. You do one at booking and one at 24 weeks, and you actively manage any disease flare. You can talk about giving corticosteroids, and you can talk about, possibility of impaired glucose tolerance with that. And you talk about other possible medications that she might be taking, like Plaquenil, like antimalarial sulfasalazine, or as a thioprin, and depending on this disease and any contraindications in pregnancy. Absolutely, Dr. Nazia. And this is the differential diagnosis. Very good. Okay, and you have to counsel the patient. You have to give them information about risk in the pregnancy complication, for example, preeclampsia, and you will do a fetal monitoring. You'll do a regular growth scan for these babies, especially because why? Because they can be susceptible to IUGR. They can be susceptible to oligohydramnios. Now, what do you mean by RO positive, Rho positive mothers? Who are the Rho positive mothers, and why are we worried about anti-RO antibodies? Anybody? Yeah, so the anti-RO positive mothers have a 2% increased incidence of congenital heart block. So an excellent candidate, you see we have 4 categories: excellent, clear pass, borderline of fail. So an excellent candidate will be able to tell us that if she's coming with SLE, I would also refer her to cardiology to check for any problem with the heart. So consider fetal heart rate check weekly from 16 to 26 weeks. Approximately 30% of patients with SLE are anti-Rho and LA positive. So again, the most important thing is control of hypertension. If she's having hypertension, either you're going to give them Aldomet or methyl-dopa or labetalol. These are both the drug of choices. And you may also talk about blood thinners like low molecular weight heparin. And you may also talk about if there is any nephropathy, how you're going to manage this case as in a multidiscipline. What are the effects on the mother? What are the effects on the baby? What are the effects if there's any preterm birth? What happens if the patient lands up in an ICU, etc. So all these things are very important, and these are the things that you're going to discuss. So they may look like a lot, but at the same time, these are the things that are required, and you have to say all that in 10 minutes. Okay. And then in terms of clinical judgment, the examiner will expect that you will talk about, different trimesters, first, second, and third trimester, then her treatment during labor, and her after delivery management. So what about the mode and timing of delivery? Especially if she has preeclampsia or IUGR, of course, you have to expedite and maybe, warranting a preterm birth. What about corticosteroid cover for fetal lung maturity? What about if she is in prolonged labor? What about, can you let them go post-date? All these things you need to talk about, and especially in the postpartum, because 2/3 of these cases will develop postpartum blood pressure, and you assess for thromboprophylaxis. We talk about birth control or contraception. We talk about future health. We talk about follow-up with rheumatology, follow-up with renal, and you talk about risk of postnatal flare. You talk about baby follow-up with the pediatrician if there was an anti-Rho positivity. And you also talk about, routine contraception and birth and preconceptual health before next pregnancy. So all these things are so important. And then what about the risk management issues? So it's a high-risk pregnancy, so careful care plan is useful. And what about the communication skills? What does the examiner expects from you in cases of medical problems in pregnancy? Relevance of your justification of your labs, your flow and articulation, and your evidence of organized thought process. So that's your communication with the examiner, how fluent you are in answering such OSCEs. Okay, so depending on that, you can easily achieve an excellent or a clear pass. We don't want you to be borderline, and we definitely do not want you to fail. So when we talk about these in detail, how to attempt these kind of OSCEs, we will talk to you about exactly how to crack this within 10 minutes. Now, always remember, you may fail a maximum of one station and still pass the exam. So if you are having a bad time at one station, please do not carry that nervousness to the next station, because next station is a new story. Now let's talk about the clinicals. The clinicals are the 25 minutes. This is something which is very unique to the membership of Royal College of Physicians of Ireland. And now we talk about what is required to pass. So I'll give you a clinical example. Now, this is slightly a longer case. When you go inside again, you have 25 minutes. You're asked to stand at outside the door of the cubicle, and then you're asked, when the bell rings, you go inside. Now, before I start that, let me see. We have a couple of questions in the chat. Dr. Nazia saying the lupus nephritis mimics preeclampsia, need multidisciplinary team management. Yes, Dr. Nazia, well done. Okay. So we can take all the questions in the end about the exam and about the clinical examples and all. So let's do this long case. Now, this is an example of a long case, which is a gynae case, basically. So you're asked to review a 21-year-old woman who has complained of increasing abdominal pain and severe dysmenorrhea over the last 6 months. Now, catch the buzzwords: age, 21 year, increased abdominal pain, dysmenorrhea, 6-month history. Okay, so she has always felt that her periods were painful since she was a teenager. However, they are now causing her severe pain, particularly on the first 2 days of menstruation. She's been unable to attend university, so she is having sick leaves. She has no medical or surgical history. She presents today to the gynecology outpatient department for an urgent consultation. Her LMP started 2 weeks ago. Her vital signs are blood pressure 118/74, temperature 36.8, pulse 92. So essentially, they are trying to tell you that her vitals are normal. So please take a history and perform a clinical examination, and an ultrasound report will be provided to you at the end of the clinical history taking and examination. So I always tell our exam candidates, how to take a history within the next 2 to 2.5 minutes is, the age is there, the main symptom is there. So you start by, okay, my name is Dr. Hina, and may I confirm your name, please? And when she confirms her name, and you always ask, okay, what brings you to the clinic today? And let her repeat what you have already read. Okay. So yes, let me open the chat. The history is tilting towards endometriosis. Absolutely, Dr. Elisa. I'm pretty sure it is, but let's talk about how we will break the ice when we go inside the OSCE station. Okay, so you go inside again, like say for instance, I'm Dr. Elisa, and you hand over the sticker to the examiner. You sit down, the examiner prompts you that you can read the clinical scenario. You start reading the clinical scenario. There's a pen and paper in front of you, notes, and then when you're ready, you turn towards the simulated patient or the role player, and you start. And you say, hello, my name is Dr. Olisa, and may I confirm your name, please, and age, please. So she will tell you, okay, my name is Mary, and I'm 21 years old. Now, please, some of you who may have attended a few different courses may ask at this point in time, okay, Mary, how do you want me to address you? Please do not do. There's absolutely no need for that. We have been examining you for quite a while now, and we are wondering where the candidates are learning this. Like if she has told you her name is Mary, that's enough. So say, okay, Mary, what brings you to the clinic today? Or what brings you to the hospital today? All right. So then Mary will start explaining to you the same. Give her a couple of minutes to relay all the information which you already have in front of you. And then you start taking the history. Okay. So it is very important how you make a rapport
with the patient, with the simulated patient on the day of your exam. Alrighty, okay. So this is the information passed on to the role player. So see for yourself what the role player will be expecting from you as a candidate. So you are a 21-year-old woman with increasing abdominal pain and severely painful periods over the last 6 months. You've always felt that your periods were painful since you were a teenager. However, they are now causing you severe pain, particularly on the first 2 days of menses. You are studying to be a nurse, but you have been unable to attend the uni due to pain. You do not have any medical or surgical history. You did have a laparoscopic appendectomy when you were 19-year-old, but you have never had a cervical smear. You have never taken any birth control pills. Both your parents are in their mid-60s and alive and with no major health problem, and they do not take any medication. At this point in time, if the candidate offers you any help, you will accept any help, but you have heard that a laparoscopy will give you more answers than blindly treating. Okay, so you have some idea that you may need a keyhole surgery or a camera look inside your womb. All righty, okay. Let's go to the next slide. Now, this is the ultrasound report. At that point in time, once you've spoken to the patient, the examiner will hand you this ultrasound report, which says that Mary was born in 2002. This is Mary's ultrasound. The uterus is retroverted. It's difficult to mobilize. The endometrial is 7 millimeter, which is normal. Both the ovaries are enlarged. Both the ovaries contain unilocular cysts, which contain low-level echo and demonstrate a ground glass appearance. Both ovaries are pushed towards the midline and are kissing in the central abdomen. Okay, so you get a knack of what's going on. So now the examiner wants to know the following from you. What is the clinical information that you're going to gather from the history taking? What is the differential diagnosis that you're going to tell the role player as well as the examiner? What is your clinical judgment? How are you going to manage this case? What about the risk management? Okay, and what about the clinical communication skills? How are you communicating with the patient, role player? How are you communicating with the examiner? Okay, so again, at the end of the day, you have to pass the clinical aspect of the examination to be awarded the MRCPI exam. It is very important that you take note of all these things: how to take the history, how to prepare the differential diagnosis, how to do the clinical judgment, how to do the risk management, and how to do the clinical communication in this case. So when you're joining our course online or on mock, we are going to have a lot of practice about gynae cases and obstetric cases for the long cases for the 25 minutes, and give you a lot of material how to speak for that 25 minutes and how not to have a mental block for those 25 minutes and continue to talk unblocked, unnerved sort of conversation between you and the examiner and the role player. All right, okay. Now, a small request about exam etiquettes, behaviors, and presentations, okay? Now, these are the things that we have observed in the mock exams as well as the original exams as well. Please do not ask for any water break, when you are about to enter the exam hall, because your examination is not going to wait for your water break. Please also be on time. And please also be very mindful about what you're carrying to the exam center. Some of you may be traveling from abroad and be leaving the same day. So the exam centers have facilities to hold on to your bags and your trolleys. But at the same time, please make sure that you are mindful about, where you are leaving your things. Okay. And then the most important thing is how you present yourself. Don't appear upheaval, or don't appear that you're coming in dressed up in something that has not been ironed and pressed properly, or some clothes which are not very appropriate for that day, like some very bright clothes or some very sort of unheavily and ill-mannered clothes. And believe you me, we have examples. We have been there, seen that. That's why I'm emphasizing on your behavior and presentation and exam etiquettes as well, especially when you are in person attending the clinical exams. So your appearance and behavior will be reflective of your exam performance. And I took this photo from the internet, but believe you me, we have seen such candidates as well. So please make sure you're not one of these candidates, okay? Now, what is required to pass again? Now, ideally, you should be confident. Confidence is the key. You should be well presented. For that reason, you have to make sure that you practice really very well, practice in mock exams, practice in mock courses like this one. You should be able to speak clearly, decipher clearly, be verbally very assertive, and you should be presenting the best version of you in your exam, please. That's very important. And then listen for the alarm. So if somebody is telling you 15 minutes remaining, you need to wind up the long case. And if you have gone in and then the bell rings, again, don't let them tell you, please come out, the time is up, please come out. Listen to the bell. So be attentive to what's happening around you. And remember, there are rest stations in the OSCE, number 4 and number 8. So you will get a chance to sit down. Do not spend any energies to listen to what's happening on your right and left while you're in the rest station. Use the rest station for resting and relaxing and drinking water. There's ample amount of water and tissues present there on the rest station for you to rest really. Okay, so this is going to be our mock clinical exam structure. We are going to give you one active and one passive candidate, and we'll do 25-minute task, and we'll be doing 4 tasks in different rooms. And then we will be having this kind of an OSCE circuit online as well as on mock, where we will be laying down 9 stations in different rooms if online, and in a single hall if on site, and there will be 2 rest areas. All righty, okay. And just for your interest, last year passing rate, because you might be thinking, am I good enough? Will I be able to pass? What is required of me? What if I fail? So this Irish exam has got a pretty good passing percentage, especially for the international graduates. See, all candidates' overall passing percentage was 71%. But out of them, the international candidates in the first attempt, 61% of you passed. And in all attempts, 71% of you pass. So that's a very good, very promising percentage as well. And this was my thoughts on the college magazine, that preparing for this exam helped us to become a better doctor. It not only allows us to develop our skills as clinicians, but also adds value to our interpersonal skills of empathy and understanding of diversity. So as MRCPI has now opened new exam centers across the world, this has helped international candidates immensely, like you and us, and we can now take our exam closer to home without the hassle and expense of visa acquisition, travel, and lodging. So with this, I thank you all for your attendance and for your attention. And let's come and chat. Let's open the floor for any questions that you may have, and the team med exam expert is there to help you in any way. Whenever you want, you feel you're ready to book for our online mock course or our on-site mock courses as well. All right, so any questions? We are open for questions now. Thank you, Dr. Nazia. And thank you very much all of you. Yes, hello. Yes, yeah. Who's that?
Anila.
Yes, Dr. Anila.
Okay, I just wanted to ask you that how it is going to, how you are going to take us, what would be the way, in each session, what would be your expectations from us, and what should we expect, will there be any group for to help us, so all the time whenever we have any query we can ask from someone will be there, what would be the thing?
That's one of the best questions, and actually it's not one question, it's 5 questions, and that helps me a great deal. Thank you very much, Dr. Anila. So answer to all of your questions is yes, 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 and yes. So the first thing is yes, there will be groups. Second thing is yes, there will be 24/7 somebody answering your questions. Third thing is that the way we do the modules, and we do the OSCEs according to the modules and the long cases according to the modules. So we will take you through the modules. I've made sort of about 11 or 12 modules altogether, and it also includes additional modules for patient safety and for leadership and communication skills, okay, and risk management. So these are the things that you may not get in other courses as well. And all these modules, including OB modules and the gynecology modules, say for instance, oncology oncology, say for instance contraception, say for instance early pregnancy, say for instance operative gynecology. All these modules will be covered, and OSCEs relating to these modules will be covered. And then we can have one active, one passive, or depending upon the number of candidates, we can talk about, have opening different rooms, and there will be people like you and me, and we will be sitting with role players, and we will be performing these OSCEs, and there will be proper bell ringing, and you will be timed according to that. So that's something that is very unique for these kind of courses, that you can prepare for the exam ahead of the exam in an exam-based scenario. The good thing is that our Riyadh center for the mock exam is the same center which is actually the exam center. For those of you who are living in Riyadh or who have access to coming to Riyadh, you're more than welcome to attend our course. Our other course centers will be in Pakistan, in Islamabad, and also in Dubai for the med exam expert. So the dates will be announced very soon. So keep in touch with our med exam expert team and have a look at the social media as well. So again, the answer to all your questions were a yes, Anila, and I hope that answered everything. Anybody else? So where are you all online from? Let me know where is your location today from? Like Anila, Asma, Aisha, where are you all from? Maimuna, Nazia, Dr. Olisa, Dr. Rabia, Dr. Alim, Dr. Okasha, where are you all from? Dr. Shazia, Tuba. Let me see if you are active in the chat. Alrighty, okay. So I see the question in the chat as well. Okay, United Kingdom, Saudi Arabia, UK, living in Saudi Arabia, Pakistan, Riyadh, UAE, Dubai. Excellent. So welcome from all over the world. And I think the world has become smaller by the help of, organizing these kind of webinars that we all can talk to each other. We all can allay our anxiety. And most importantly, if you have any worry in your mind, please, this is coming directly from the horse's mouth, because, I have been organizing these exams, for the last that many years, that I can tell you, what is the key to success. The key to success is your confidence, number one, and number two, the way you present yourself, and most importantly, the way you time yourself for 10 minutes and 25 minutes on that particular day. Believe you me, that's the thing that is very, very important. Okay. So with this note, I say farewell to all of you, and the recording of this webinar session will be available on our social media platforms. And thank you very much, Team Med Exam Expert, for arranging this webinar, this very important webinar. And we hope to see you all in our upcoming clinical OSCE courses online, as well as mock on site. Thank you very much. Signing off from this side, this is Dr. Shazia Masood. Bye-bye.